Yes, Bill. All right, take two. Just kidding.
Let's start over again.
Okay, then we'll have the executive session, or I'll read that at the time. So, Sarah, the floor is yours.
Good evening, Mayor Farrell, Council President Kochmar, Deputy Mayor Hunda, and members of the council. Thank you for this opportunity tonight to talk about homelessness, especially as we look to the potential allocation of ARPA funds for social services. Homelessness would be one of the potential prioritization areas that we will be considering. As we've talked about during the ARPA process, we will be looking at a variety of engagement mechanisms on different focus areas in the community, like homelessness, childcare, youth services. So this is one of those opportunities to kind of guide what that engagement might look like around homelessness and the potential investment of ARPA dollars. During the pandemic, we talked a lot about adaptations to services to address the increased risks that people experiencing homelessness had. This followed a long history with our homeless service delivery system not having the capacity to adequately address the need that existed in the community. And now as we come out of the pandemic, what we see is we still have a lot of people facing housing instability, rising rents, inflation, all of those things compounding to add to our homeless service delivery system and the burden that's on it. And then all the people are currently experiencing homelessness still need those services, the same services that address their housing, root causes of homelessness, support services. Tonight we'll give just a little bit of an overview. We have a number of partners that Mayor Farrell already referenced, and I won't do introductions there, but I would just add that when we talk about homelessness, it should include the many different people who experience homelessness. We have families, individuals who have disabilities, many who don't. You'll hear some of that data from Alexis with the King County Regional Homelessness Authority. We have people who do have mental health disorders and addiction, and a larger number of people who don't experience those concerns. When we look at people who lose their houses, they look very different. The reasons look different too. So our services that address homelessness vary. We do need housing as a piece of that, whether that's through prevention, shelter, transitional housing, permanent housing options. It also has to include looking at those root causes, support services around behavioral health. That will come in some of the other prioritization areas. Some of our partners will address that tonight too, talking about the intersection of support services with the services they're delivering. But we will want to talk about how those other services come into play and are needed for people who are living on the street. So this evening, one thing that we'll be doing is listening to the questions and the comments that you have and that our providers are giving, and that will guide that engagement in the coming months. This will be a really quick process following an allocation by council, assuming that social services is included in that. We will move quickly so that we can get funds out and hopefully helping our residents as quickly as possible. I'd be happy to take any questions. Otherwise, we can move into our guest partners.
Any preliminary questions? And Councilmember Dovey, would you mind moving your water carafe so I can make sure that I down the road? Yeah, that way, because that way I won't be doing that all day, all evening. All right, so thank you. All right. All right, seeing none, let's go ahead and hear from Mr. Flora, Leo.
Good evening, Mr. Mayor, Council President, Deputy Mayor, and council members. For the record, my name is Leo Flora, and I have the privilege of directing King County's Department of Community and Human Services. And my goal here today is first to extend continued appreciation and thanks to the City of Federal Way for your partnership and leadership in participating in the Health Through Housing program that is now in ownership of 10 buildings across King County. Federal Way is one of those, about 100 rooms. We have 980 rooms so far that we've been able to acquire since the beginning of the initiative. And those are spread across now 6 cities across the region. In addition to a brief update on the building, city staff informs me that it might be perhaps most useful to talk about services that we plan for the health through housing program within the building, and then can answer any questions as we go or that you might have at the end. So the building itself, the former Extended Stay America in Federal Way here first, a second chance to thank the city was in partnership with you that we were able to temporarily use that facility to provide housing for refugees, primarily from Afghanistan, although not exclusively, who were relocating into King County. At the time we ended that use in Federal Way, and it has now concluded, we were able to provide a place to be, a place to live for more than 400 refugees who came to King County. And we really value the time that we were able to provide that service to those individuals as they came to our nation. That service now continues at the Redmond site for health through housing. What we are looking at now is we have recently been able to announce a provider at the facility that we'll have here in Federal Way, the Urban League. We're excited and saw that that was also able to go out on some of the city's channels of communications. What we'll now be doing is entering into a process to consult with the city and then to set a contract with the provider. We have a health through housing handbook that defines the types of services that must be provided, and then also the performance measures that we'll be monitoring the program with. When we talk about services, as we have had a chance to previously share with members of the council, certainly behavioral health services remain at the core of what we're going to be providing in terms of on-site services as well as medical services. Some examples, and we're able to now talk about actual examples as some of the other health through housing buildings are up and operating. On-site nursing stations, and we also have with us here Catholic Community Services operating a building in Renton. I'll describe a couple of the services that are on site there right now. So nursing stations, the provision of behavioral health care and behavioral health care, both for the purpose of inducing folks and allowing them to begin treatment for substance use, but also ongoing counseling for mental health care that they might need to continue to receive. We also have a dedicated team of crisis responders whose whole purpose is to be responsive directly to health through housing buildings and to handle behavioral health crises that might not be something that the day-to-day staff are fully equipped to handle. We are in the process of hiring that group and fully expect that it'll be up and operating by the time we start operations here in Federal Way. In addition to those behavioral health services, we have a team of employment navigators who are dedicated again specifically to health through housing buildings, although using best practices from employment navigators across the system that DCHS really works with. Their goal will be to identify folks within the buildings who might benefit from job training. And a couple of specific examples of the connections we're able to make there is partnership with Fair Start, for example, where we're able to have the recipients of the services actually receive a salary, weekly pay. They pick up skills in an industry that we need more folks working in across the county. And we're really excited about that partnership and others. And then transportation, and that's certainly something that we've heard from members of this council and previous conversations, as well as from residents of Federal Way. We have now in place a partnership. We just signed the memorandum of understanding with King County Metro for dedicated transportation using smaller vehicles to and from health through housing facilities. It's not to say that's the only way that somebody would come from a facility, but it will allow us to have dedicated publicly accessible transportation so that folks residing within a building have the ability to come and go to places that are sort of high frequency or where we might need to accommodate for a person because they're not able to transport themselves to a particular type of appointment. So as we take a look at health services, both physical and behavioral health, for initial sort of intake into services and introduction, and then ongoing, what I would almost equate to as primary care, both on behavioral health and physical health sides. Then the ability to layer on crisis care and having specifically funded resources that are available. And we know that both of those parts of the equation are really important as we're seeking to stabilize and support residents within a building. And then the ability to provide the employment assistance is something that we certainly heard as important from the council, and which we agree is really an important part of services for some residents within permanent supportive housing. Although, as we have discussed previously in previous meetings about health through housing, it is the case that some folks who reside in permanent supportive housing have a disability such or an age that we are not likely to expect them as a community to go out and become employed, although certainly anybody who wants to will be working with them. Transportation, again, as what we think is that important component. And then finally, housing counseling itself, so that we continue to both support people in seeking further and more permanent types of housing and permanent housing after permanent supportive housing where that's possible. And so that we're able to really assist with a lot of the development of both the capacity and the skills within a lot of the folks who are living in buildings, so that if they are able to seek employment or are able to attain public benefits in such a way that they are no longer financially eligible to live within a health through housing building, which is limited to 30% of the area median income, that they're able to transfer those skills, experiences, and resources and then remain housed after leaving. Subject, Mr. Mayor, to any questions you may have, I can end there.
Council, any questions? All right, Council President Coach.
Thank you, Leo, for your, this is the most information I've heard about services that are going to be provided. Can you tell me, my understanding is that 85% or 85, since 101 units, 85 will be from the Seattle King County area, will be brought to our community. Is that correct? How are you vetting them? What type, I mean, for example, I read in the paper where some of these are going to be chronically drug addicted, my understanding. And since drugs are allowable in your unit, our concern in this community is how this will spill over into our community. But more than that, how are you vetting the people who are going to be, I mean, you have wonderful services, but if they don't take advantage of the services, do you have a limit on the time that they stay there, so that somebody who does want your services, can you, I mean, how do you vet these people?
Absolutely. Thank you, Council President. To hit a couple elements of the question. First, I understood part of the question to be the percentage of persons residing within the building that are what we would call locally referred. Previous in discussions with the city, we had really sort of set out that the statutory minimum is 15%. In other words, at least 15% of the residents of the building must be from the Federal Way area at the time that they receive services. What we've since been able to do, and what I'm happy to announce here, based off a lot of the interest that we heard both from the community and the council, is that we are committing an initial 65% or 2/3 of the rooms for local referral to any host city that has a facility. I think it's the right thing to do. I've got Mario Williams Sweet, who's our program manager here, who's implementing that. And we look forward to working with the city of Federal Way to make sure that that's accessible in a meaningful way to you. The second question that you asked, Council President, is about sort of affiliation or association with the Puget Sound region generally. The remainder of the referrals, so essentially the other 1/3, are available through what we would call regional referral. All of the intake for that does occur within King County. We have Alexis here, who's may be able to speak with more detail, as that's a program and service that the Regional Homelessness Authority is now assumed control of and implementing. But I can say that our intent is, and our goal, and the way that the structure is really setting up, Council President, is that this is a resource for King County. The next part of your question, as I understood it, is just to talk a little bit about how we take a look at folks as they come into the facility, and then whether there's a permanence or a time requirement. So anybody who's going to be coming into the facility will either be subject to outreach and initial exposure to services locally. Some of those partnerships will be by providers who are already in Federal Way, where they'll connect them to services, and then some of them will be regionally, so it will happen through the coordinated entry system. But in both of those cases, I think it's really important. I think it's an exceedingly rare case that somebody goes straight from living outside, unsheltered, into permanent supportive housing. We often have to sort of transition them through a series of interventions that often requires things, the sort of shorthand in the field is document ready, but we got to get folks all the sort of paperwork, benefits, and systems in place where they're able to sort of acclimate to coming inside. We don't seek to extend that period any longer than we have to. It's important to get folks in as fast as possible. But again, it is really rare that somebody goes straight from residing perhaps in a tent into permanent supportive housing. I wish we had that much inventory, but it continues to be the case that we don't. And folks often have to sit in line and receive services so that we can contact them as a practical matter when it's time to come in. And I think we've got a couple of providers who'll be able to speak really eloquent and in detail about what that connection looks like. But by the time somebody comes into the health through housing, into a health through housing building, they are likely enrolled in and receiving behavioral health services at that point, for example. And that's a way that we actually learn quite a bit about a person, to your question about screening. And then as to permanence, there is no maximum time for which a person may reside in permanent supportive housing. There are certainly circumstances under which a person will either become ineligible or might not be able to comport with or comply with the requirements of being in the program, in which case folks are asked to leave permanent supportive housing. That's not a thing we're after, obviously, but it does happen. And in all of the cases, we will require, but the providers already do it through our health through housing program, that there be codes of conduct that individuals must sign to and adhere to. And what we've really found is the people want to stay housed generally. The operators want the facilities to run well. The host cities certainly want the facilities to run well, and we want them to run well. And so all of that really moves us towards a system in which we do have standards inside of each of the buildings. One thing just to note, in your question, Council President, you mentioned use of drugs. It is true that if it's illegal outside the building, it's illegal inside the building. And so I do want to clarify that there is not a different set of standards or laws that we're applying within the building. It is also true that folks who come into the building may in some circumstances be using drugs. And our goal at that point, as it would be anywhere in the behavioral health system, is to connect them to treatment, to get them into a healthier situation. That does not necessarily require abstinence to be within the building, but we are seeking to expose folks to treatment, get them to healthy habits, to stop using drugs, and to be able to remain housed. I think I got all the parts of the question.
Wow, and I didn't see you take any notes. That's it's good job, Leo. Let's go in order that I saw the lights go on. Councilmember Walsh, Councilmember Dovey, the Deputy Mayor, Councilmember Erica Norton, and there's only so much storage capacity here, and then Councilmember Sefa Dawson. All right, Councilmember Walsh.
I have a few questions. One is I was very disappointed when I heard that the Urban League would be managing it rather than a local organization. And I mean, the Urban League has never actively been an active entity here in Federal Way. And so why was something that is geared towards downtown Seattle managing this rather than a local entity?
Absolutely. We are limited to who applies to a request for proposal. So I do think that defines the universe of who we can select. I think I'm not here to disagree with you, Councilmember, on the characterization of the Urban League only serving downtown Seattle. I believe the Urban League would say that they serve a larger contingent, but I take your point that it's not a Federal Way based organization. One of the strategies that we do have, however, as we are seeking to expand the number of organizations that can provide permanent supportive housing and do provide permanent supportive housing across the region, which is necessary as we're growing the stock of housing, is to partner with organizations that do know and have experience or perhaps local experience. And so we have certainly been in conversations with Catholic Community Services as a locally affiliated provider about how they can provide assistance and support to the Urban League as they come online. And then I think the last component of the question is communities come in several forms. Some of them are geographic, some of them are cultural. And what we do see with the Urban League is that they have a strong and long history of credible and effective service to the African American or Black community in particular. And that is one of the two communities that we are required as a statutory or an ordinance matter to ensure that we're reducing racial ethnic disproportionality for in the implementation of the program. And so one of the strategies as we take a look at it is to make sure that we are both accounting for geographic community, but also racial ethnic or identity communities. And we believe that the Urban League will be a really strong partner and a leader in that work.
And that's even though that here in Federal Way, I may be wrong, but I think that the majority of the homeless population here in Federal Way are not African American. I mean, they are of other races. And so it seems like that's kind of irrelevant for our community here. I mean, personally, I think that it should be colorblind anyway, but that's beside the point. You said that, with referring to drug use within the building, you said that if it's illegal outside, it'll be illegal inside. That is not very comforting. That's not comforting at all because, I mean, there's open drug use outside But it seems like that inside, I mean, you know, you mentioned that there were, that if they did not abide by certain things, they would be asked to leave. What are those standards that
Absolutely.
they do not abide by, that they'd be asked to leave?
Absolutely. And we do, again, I think it's, I would certainly also ask any of the providers who are present to talk about that, because it need not be a hypothetical thing. They've got codes of conduct that they adhere to now. But a person whose conduct endangers in a material or consistent way the safety of other residents or themselves, folks who engage in certain particular activities. So setting fire to a unit is a thing that we're certainly very watchful of and have to be protective of. I think there's also, and I really would invite some of the providers to speak more eloquently than I. Folks are looking at patterns of behavior. Folks are looking at patterns of improvement or not patterns of improvement. Again, we're not typically operating a system that says if you mess up once, you are now going to be homeless again. And the council president's question got to this. At a certain point, all of us are really taking a look at making sure that we're providing housing to folks who are able to take advantage of it. And if we certainly have a lot of folks who still need to be housed for everyone who is housed in our community across the region right now. And so those are some examples of the types of conduct that can get a person removed from a building.
Well, what about the sale or distribution of drugs?
I think I don't know specifically what it says in a code of conduct about that right now, but where we've got a criminal matter, obviously we're going to be inviting the criminal authority to handle that issue. And I do think an apartment is a pretty good analog here. A person can use some types of drugs in their apartment right now and it's legal. A person can use some types of drugs in their apartment right now and it's illegal. As you pointed out though, council member, throughout anywhere in King County or federal way, what happens when a person does an illegal thing? There's a range of responses that we see. I'm not here to speak on behalf of law enforcement, but I am aware that in every case of the use of illegal drugs, particularly where there's not an intent to distribute them more widely, that it does not necessarily result in arrest or removal from housing. And I think we would expect to see that same pattern within health through housing.
Thank you.
Councilmember Dovey.
Yeah, Leo, thank you very much for your presentation. It's been very informative. I really appreciate it. The only question I have is, and maybe it's too soon to know, you talk about the timeline to move from HTH housing, whatever the acronym and you said, to where somebody becomes self-reliant and can move out and get a job and, you know, become more productive, because this is a stopgap to help people. Is there any studies on that, or is it just too new to know what the timeline looks like for someone actually to come to the program, get the benefit of all the things that have been listed, which are great. I applaud you for putting this together. And then what we should be looking for, so when we're bringing people out, so somebody else can come in and, you know, we're getting a more productive citizen in our community.
Absolutely, Councilmember. As I mentioned before, and I certainly heard this in city staff's introductory presentation, I think we are sort of holding a wide range of persons when we talk about residents of health through housing and folks experiencing homelessness generally. So it is the case that some folks who move into permanent supportive housing will never leave permanent supportive housing. But for that set of folks that's not the story, what we see as a matter of data are that about 10% of residents in permanent supportive housing generally will leave a building over the course of 1 year. So about 10% turnover. We experience a much higher rate of turnover with shelter, and to the extent that health through housing is not purpose-built permanent supportive housing, we would expect to see and we are looking to see a higher level of turnover. I wouldn't expect it to be dramatically higher. So in a 100-room building, I would expect we're going to see somewhere between 20 and 15 rooms turnover because people are able to move on. At that point, we're measuring where they go and then how long they sort of stay in a housing intervention that they'll move to after. But I wouldn't expect to see a 50% turnover in the buildings.
All right, Deputy Mayor.
Thank you. Thank you for being here. Will you have families in this facility?
The facility, thank you, Deputy Mayor. The facility, as we are building it and programming for it, will not have kids in it. So it will be adults. There might be 2-person households or 1-person households within the building. They might be of any gender identity, but we won't have kids in the building.
So the youngest person then could be 18? Is that?
I think that's right.
Will all of the health through housing locations have the same makeup of 65% local people selected to live there, or?
That's
all
right.
of them?
And as a chance to talk through how that works, at initial introduction of the building, we will make 35% of the rooms immediately available for what we call local referral. 35% of the rooms immediately available for what we call regional referral, and then that middle 30% immediately available to the host jurisdiction, to the city, for additional local referral, but with a 4-month timeline on it. If there are rooms not filled by local referral after that 4-month timeline, then we'd revert to regional referral just to not have rooms stay empty that long. I have a feeling that that's not going to be an issue that we run into.
And the neighborhood right next door to this building is full of children. And at the recent National Night Out, which is just last Tuesday, I spoke with some of the families. They're very concerned and have a lot of questions. Will you be reaching out, or someone in your department reaching out to talk with them and tell them what's going on and what to expect?
One, we absolutely are happy to reach out, talk to anybody who wants to talk about the building. It is a concern that we hear about in health through housing buildings across multiple sites. We have one in Kirkland, for example, that's sited next to a school. We have one in Seattle that's sited next to a school. And then we do have permanent supportive housing and housing generally that's sited near schools and within neighborhoods. We do not at this point have an active plan to do outreach or an active date set with that community, but I'll take it as homework from this, Madam Deputy Mayor, that we need to, and we're happy to do it. I think it's going to be really important. And now with the provider on board, I think that's going to make that an even more productive conversation, because we'll really be able to establish those relationships between the community and the folks who will be at the building and staffing it all 24/7.
And my last question is, at one point, there was one site that the people in that city took some legal action against the building. Is that still ongoing?
There was a lawsuit filed within the city of Kirkland, I believe in Snohomish County, alleging a number of issues against the county. All of the issues against the county have been dismissed by the court, and there is no longer pending legal action against the county.
Thank you.
Councilmember Norton.
Hi, thank you for your presentation. So, okay. Just a little background. I have a construction cleaning company, and my company has been cleaning newly constructed permanent supportive housing units for the past 2 years in Seattle. And from what I've seen is there is no barrier to the drug use and the behavior of the people that are living there. What they do is they build the buildings, they build half of it, then they put the people in, and then they build the other half. And while we're there working on the other half of the building, we have to have 24/7 police presence to protect us from the inhabitants of the other half of the building. They are openly using drugs. And there's, these have been in every kind of neighborhood you can think of. I've been in downtown Seattle. I've been in the Rainier District. I've been up in Greenwood. Right now, my company has cleaned 6 of these buildings. Okay, I can give you the names of them if you don't believe me. What I'm saying is, from what I've experienced over the last 2 years, being around these buildings that are, the police are, I have pictures and videos of the police constantly being there with large guns that they look like machine guns to me, because I'm not educated in that type of firearm, but it's not exactly a safe place for kids to be around. It's not a good environment for children. And so my concern is, how is the city going to be reimbursed for all the additional support that we're going to have that will be required? Because there will be no, I mean, you say that our laws, if it's against the law outside, then it'll be, well, there aren't any laws against drug use right now. There are people who are allowed to do whatever they want. So my concern is the safety for the kids in the neighborhood, because it's right next to a school. And my concern is using up our resources, which we're already pretty thin with our law enforcement officers. Is there some kind of program that is going to be implemented to reimburse the city for what this is going to cost us? from having this additional hotspot created? I mean, because I'm being realistic. It's just from my own experience, this is going to be a disaster. I mean, let's just be honest, especially for the people who live there. How are we going to deal with the financial repercussions of that? Do you already have something implemented with the city of Seattle, for example, or the neighborhoods around there to help them deal with this kind of impact?
Thank you, Councilmember. I think two parts to respond to the question. One is, it is true that depending on where you look at permanent supportive housing or affordable housing, the ability to fund operations and services within those buildings is highly variable across the whole portfolio. It's something that Health Through Housing has taken a different approach to. So within the same revenue source that provides the capital funding, we have the ability to fund at the highest level of any affordable housing within King County services, and to be able to forecast that out at a much longer contracting interval than we are with any other affordable housing. And then I did mention that largely animated by many of those same concerns, making sure that there are services that are available so that we can operate safe and healthy buildings. We have, again, a lot of the behavioral health services that frankly, often the providers would like to have those available everywhere, but the Health Through Housing portfolio does have a higher level of funding. And one of the things that we are looking to get out and to prove is that when you fund services for providers on site, that you can make a real difference in the way that the building operates. To the second part of your question, which is a direct and factual question, there is not an agreement in place with any of the jurisdictions right now as a formal matter that would seek to calculate and then negotiate funding for use of law enforcement services. One of the things we're watching and that we certainly have seen is that depending on the control group, you get reduced use of services for persons relative to when either they're in congregate shelter or outside. We don't have a specific data set to Health Through Housing for that. And so I also want to be clean about the facts as we go forward, but it's one of the things I think we're interested in really making sure that we understand is what types of services are coming to the buildings. How can we form relationships that can reduce unnecessary use of services? And we've had some experience actually in the city of Federal Way with that when we were operating for refugees. We had about a 4-week run where I think we actually called the fire department every day. In one of those cases, it was new members of the country weren't familiar with the use of microwaves. And what we were able to do is A, to do some education within the building, B, to speak to the fire department and set up a system where we reduced the frequency of the travel. I don't want to say we got it to zero, but we take very seriously that the building is a member of the community here. We have an obligation to the community to be good neighbors and to become better neighbors. And we are very interested in making sure that we do not have unnecessary use of emergency services coming to the building.
Okay, thank you. So are you, okay, my company also provides services to Multi-Service Center and to veterans. So I do ongoing cleaning, and I've been doing it for several years in a couple of the permanent supportive housing units. And I see that one of the biggest problems that the counselors have is getting the people to actually take advantage of the behavioral health opportunities that are being offered. They just don't want them. It's not required. And so there's a lot of people who just sit around in offices and don't really do anything. That's one of the biggest complaints I've seen from the employees of these at these permanent supportive housing units, where there's no barrier to the drugs or alcohol use. So will you be, is there some way that we could ask for security at these buildings? Because the only ones I've seen that aren't complete trap houses are ones that have security. Is that something that you're asking Union Gospel Mission to provide, or is that something that we as a city would have to implement with an ordinance?
Not for me to correct. I believe Urban League council member
Urban League, okay, whatever.
organization.
Doesn't matter.
So we are, and I think this is an example of hearing from a community or a city and wanting to adjust where we can and where it makes sense. So I think the security question is a good one, and where a building looks like it would benefit from security, which can come in many forms. That's a service that we're absolutely willing to have a conversation about. What we have found so far is that I'm unaware of any of the current health through housing buildings where we have or have needed active 24/7 security to
The
be on site.
Veterans Building on 99.
Councilmember, I don't believe the Veterans Building is a part of the health through housing portfolio. I don't want to discount, and I don't know right now and can't speak credibly on what services are there. I know Multi-Services Center does important work in our community.
But you used that as a hallmark when you came and talked about how wonderful it was. You were the one who brought that up as being one of the best examples of your program. So now you're saying it's not a part of your program?
It is true that it is not a health through housing building, Councilmember. I recall that
Oh,
that
okay.
conversation used the William Wood House in
That's what
Federal
I'm
Way
talking about.
as an example of what permanent supportive housing is. And as I mentioned, I think one of the things that we're really testing and that I think is important about health through housing is what does it look like to provide even more services than is available typically at permanent supportive housing, recognizing that we're seeking to work with a population experiencing or that was experiencing chronic homelessness and anticipating that they'll have a real intensity of needs and we're going to need those services on site.
Okay, thank you.
Okay, Councilmember Stefanosson, and then we're only gonna have about 30 minutes left, so let's handle this question, and then we've got probably about 6-7 minutes for the per provider after that. So Councilmember Stefanosson.
Thank you so much. Thank you, and good to see everyone. I may not get another chance, so. That said, I have a couple of questions and then I want to make a comment. So are participants allowed to make self-referral, or do they go through other agencies to come to the facilities?
Nobody can walk right up. So the former use of a hotel is sort of misleading in that sense. I do believe that people can self-refer into services and then would be able to be assessed and be eligible for placement into health through housing. But you would have to come through either an outreach worker or a service provider. I don't believe anyone could just sort of call up and ask to get on a waiting list.
Thank you. So right now, King County pays for everything. So local jurisdictions are not expected to support financially. But is there going to be a point where we're going to have to start thinking about budgeting for these programs?
No, and certainly not by the way we've designed it. The 1/10 of 1 cent sales tax that the King County Council imposed councilmanically as a part of this program is a sales tax that's in place in perpetuity unless they act to rescind it, at which point I think the entire program would have to end. But I'm not aware that that's something that the County Council is considering right now. And we have budgeted the program again so that it's providing a higher level of services funding than certainly is what is available in other supportive housing. And then we have set the program's fiscal plan up in a way where we assume that we're going to continue to pay and actually inflate costs year over year to account for increased costs over time in a way that we're not usually able to. So while I can't represent what the King County Council may do in the future, council member, we have organize the program so that if the revenue continues to flow and there's not a major economic change that would eat through our reserves, that we have the ability to continue to operate the program.
Thank you. So I think what would be very helpful is once you start the program is have regular updates, maybe with council, and also having a presence of safety, public safety or police department there on a regular basis. But I do support this project just because we do have a lot of people on the streets. And we hear from our residents who continuously say that they don't want to see them on the streets. So something has to happen. And I think this is a great solution for that. And also I like the fact that the city does not have to pay for it. As someone who was a housing director for a nonprofit for transitional housing for up to 24 months, we serve people with HIV/AIDS who came straight from the streets, but they were referred through other agencies. And so that partnership with the agencies helped us. And there were people that we did have to kick out because they did not follow the rules and of the program. And so that was not hard to do. They signed an agreement and they do get kicked out. One thing I do believe and I know is without housing, people are not going to be able to be successful even when they try to get off drugs. And so I believe that this is a fair chance for people to work on their issues with the support that they have, with roof over their heads. And so I'm really excited to see how this is gonna work. And also you said this program is in 6 cities. And so I just really hope that they all become successful, because I feel like this is one way of addressing the problem that we all see. Because I'll talk about, like shopping carts that they walk around with. We talk about bus stops that they set out. There's a lot of things that we talk about, but I believe this will address a lot of those things. So I want it to be successful. And yeah, so that's my comment, and thank you so much.
All right, thank you. Thank you, Leo. All right, we're going to hear from Alexis Mercedes Rink with King County Regional Homelessness Authority.
Good evening, council. Thank you so much again for hosting us tonight. For the record, my name is Alexis Mercedes Rink, and I'm with the King County Regional Homelessness Authority. I also invited with me tonight our new South King County planner, Abigail. It is her second week, so you won't be hearing directly from her tonight, but thought it was particularly important that she come in person, because we know best way to serve communities to be out in it. So Abby, do you want to introduce yourself briefly?
Yeah, thank you so much. As Alexis said, my name's Abby. I am the new South King County planner, so I'm really looking forward to be working with you all from now moving forward, and to be presenting to you and providing regular updates. Yeah, I'm a recent UW grad from graduate school, and just really excited to get to know you all and hope to see you all very soon. But without further ado, I know we're running short, so I'll give it back to Alexis.
Thank you. Thank you again, all. I'm feeling very honored to be speaking with you all tonight. I'm going to take us through a presentation. The purpose of tonight's presentation is to orient you all to the work of the King County Regional Homelessness Authority. We're a newer agency, so wanted to talk through a bit about what our organization does, as well as present some of the latest and greatest on the data front, particularly with South King County and what we're seeing with homelessness, and talk about the work that we're doing and some recent successes. And I'll be brief because we have a number of fantastic service providers who really are the ones doing the work and making it all possible. So just by way of grounding us into a little bit of background, we back in 2018, if we can remember back that far before the pandemic, the National Innovation Service was brought on board to conduct a analysis and review of our region's homelessness response system. And ultimately what they found was that we have a very fragmented system, and their core recommendation was to consolidate homelessness response under one roof. And that recommendation went to King County Council, the Regional Policy Committee, as well as Seattle City Council. And there was discussion and conversation on the ultimate proposal of an interlocal agreement establishing the King County Regional Homelessness Authority. And that agreement was signed between Seattle and King County at the very end of 2019. 2020 was intended to be the year that everything got stood up. And as we know, 2020 took a very interesting turn. And many of the staff that were deployed to the effort of standing up the authority were deployed to other critical crisis response work, standing up isolation and quarantine around the county. And that brings us into 2021. That's when our CEO was brought on board. And we really started working around sub-regional planning and the real administrative core functions of transferring over contracts. That brings us into the work that we're doing now, which I'd like to present more on tonight, moving into the contracting work as well as planning work and some of the ways that we've been working to address the things that we're seeing on the ground. And hopeful that in 2023, we're going to start seeing some real visible transformative change, especially given the work around health through housing and the amazing work that our partners again have been doing. So just by way of what we are and what we are not, we are a special jurisdiction government agency. We administer and we receive and administer public funds. We are the administrators of programs and policies, and we partner with public and private organizations. We are not the Department of Community and Human Services, so not I do not report to Leo directly. And we are also different than Seattle's Human Services Department. We are not a public development association or public housing authority. Our acronym is way too close to the King County Housing Authority. And we do not have the ability to levy taxes. A bit about our specific role and scope. We are charged with unified planning and coordination for funding and services for folks experiencing homelessness. We have oversight on policy and contract management. We are the continuum of care lead agency as required by the U.S. Department of Housing and Urban Development. So we receive federal funding. We were also charged with the creation of an ombuds office to create accountability for our homelessness response system. And we're also charged with establishing clear metrics and milestones to measure success and accountability in our system. This is my favorite graphic that really lays out what still lies within City of Seattle and King County. Housing capital and development are responsibilities and roles that still lie with in the City of Seattle as well as King County. But we have taken on the role of continuum of care funded programs, shelter, diversion, rapid rehousing, the coordinated entry for all system, which is tied and related to health through housing work, the homelessness management and information system, also known as HMIS. And we continue to play a role in outreach, but in terms of encampment cleaning and behavioral health and crisis response, we understand that these are things that are related to our work, but we don't have full ownership over that. A little bit about our organization. We have 6 primary divisions. We have our programs division that has a number of teams within it that have hold contract management. But we also have a community capacity division that does a lot of work around technical assistance capacity building. So I know it was spoken of earlier about looking towards securing South King County providers for certain projects and opportunities that role and ability to provide that technical assistance. So more organizations will apply for opportunities. Moving into, we have the community impact team, which holds all of our data management and work, their sub-regional planning, which I'll talk a bit more about in a second, the ombuds office to ensure accountability, and external affairs in our system advocates workforce. I'll breeze through this piece because I think the real recent wins are things that our providers here today can speak to. But we have been really diving into best understanding the community and what we're seeing on the ground, and have seen tremendous success using and actually leasing up folks with the emergency housing vouchers, which were made available through the American Rescue Plan. We're actually leading and beating the national average in having folks effectively leasing up and securing housing using that resource. I want to talk a little bit about data before turning it over to our other speakers tonight, and share with you all some of our point in time count results, particularly comparing from the 2020 point in time count and the 2022 point in time count that we just completed. We did see a notable increase with the 2020 point in time count reporting 11,750 folks experiencing either unsheltered or sheltered homelessness being that they are accessing services or in shelter inside, unsheltered being those living outside. Our 2022 numbers indicate just over 13,000, so about an increase of over 2,000 folks per our method. But we've been working on improving our data and trying to better understand the scale of the issue through looking across administrative data sets. And so through strong partnership with other countywide agencies like the Department of Community Human Services, and looking at administrative data sets such as homelessness management information systems, behavioral health recovery divisions data, looking at healthcare for the homeless data as well, to best see and look across who is being marked and considered homeless in a system and may be captured within one data system, 2 data systems, or all 3, and better understanding the full scope. And so what that cross systems analysis found was that in 2020, over 40,000 different folks in King County were experiencing homelessness and marked as experiencing homelessness in one of those data systems. Wanted to share a little bit about healthcare needs that we've been seeing, as we know that we've
got about a minute or two.
Wonderful. I will keep it brief. we know that the experience of homelessness can be tremendously traumatizing on the body and the mind. And so wanted to share a little bit about what we've found, particularly that about half of folks experiencing homelessness identify as having some kind of disability, about a third identifying as having some type of mental health disorder, and 37% identifying as having some type of substance use disorder. A bit about the work of our team and how you'll see particularly me and Abby showing up over, the foreseeable future. We've continued to work across forums in South King County, trying to get out in community as much as possible, not only visiting with providers, but getting on the ground and seeing encampments as well, and talking with folks who are experiencing homelessness or accessing services. We've been leaning into some strong analytic pieces to best understand the scale of the issue as it pertains to South King County specifically, while also looking at ways that we can strengthen partnerships with jurisdictions. And so I suppose I'll close on this point in the interest of time. Wanted to share a data point that we do have within the homelessness management information system. And by our most recent poll of that was in May of that data. This data point that we have marks last city of residence. And this is something that folks will indicate when they're enrolling in services. And as of May, we had 5,830 folks who marked a South King County city as their last city of residence. Now, that doesn't entirely necessarily mean that they're seeking services in South King County. They could be anywhere, but it's what they consider their last city of residence. To put that into context, we have 295 of those folks are in a permanent housing resource. And currently in South King County, we have 623 emergency shelter beds to serve people. And on that note, I'll just close by saying we're continuing to do thoughtful data work as we come forward and talk to partners about the scale of the issue and work towards partnering to come up with solutions. And on that note, I would love to turn it over to the amazing partners I get to work with all the time to share about the work that they do.
Thank you, Alexis. All right, Rotman Korak, Multi-Service Center.
First of all, thank you, Mayor, Council President, Deputy Mayor, and Federal Way City Council members for this chance to speak. I am going to fly through this pretty quickly in the interest of time, but I did want to let you know you will have access to the PowerPoint, I believe, and I'm happy to answer any questions that come up after the meeting. Just reach out and give me a call. So a little bit about who we served. I'm just going to hit a couple of highlights that people usually find a little bit interesting. You can see that 35% of all of our housing customers last year were children under the age of 18. 8% were seniors, although I think that's often underreported, and 11% had a disability. And then I also just wanted to point out that 45% of the households we served in housing had at least one person in the household who was employed. And oftentimes people don't realize that a lot of the people that we work with that are unhoused are actually working. They simply can't meet the needs or pay for market housing. We did a community needs assessment in 2019. We're doing another one right now, which I encourage you all to fill out the survey on our website. But for the past, I would say the past at least 10 years that we've been doing this, the community, both customers and the entire community have looked at housing affordability and homelessness as a key issue in our community. And I think that oftentimes the people that we see that are unhoused or that are the most visible are the individuals that we've talked about with mental health and chemical dependency issues. But there are a lot of reasons that people become unhoused. And these are just some of the ones that we've dealt with our customers, not being able to pay market rent, seniors on fixed incomes, family instability for youth, past evictions, and all sorts of reasons. And systemic disincentives, which I'll just say as one example real quickly. We've had people who got a job, they were housed, they were working, and they were receiving childcare subsidies, and they got a raise, and that made them no longer eligible for the subsidy, but not able to make enough to pay for childcare, which of course puts their job in jeopardy, and that can also lead to housing issues. Last year, we served over 42,000 in general, but 4,000 in our housing programs, and these were residents of South King County. Now, this doesn't include the people that we house in our affordable housing in Pierce County as well. We run shelter, transitional, and permanent affordable housing. Right now, we have over 650 units that will soon change. We're adding workforce housing, and I know that term can be ambiguous, but we're targeting individuals who have at least one person in the household working. They simply just can't afford market rent. It's right next to a transit station, and I appreciate all the support that you all have done to help us with that project. We'll have services on site and a satellite food bank on site too. We have transitional housing for single women in recovery. And we do provide case management, and then of course our permanent affordable housing. So I want to talk about this one just a little bit longer than I talked about the others. I'll still be within the time limit. But I will say our William J. Wood Veterans Housing, Leo's correct, it's not the same project that we're talking about here, but it was funded by King County in part. And, you know, I'm to acknowledge your concerns, Councilmember Norton, there are definitely challenges. I'm not going to lie, there are definitely challenges with permanent supportive housing. But I think that, you know, one of the things we learned early on was that we needed to do things differently. And so in the past couple of years, what we've done is we used to have security there, and that actually didn't work very well because they had a difficult time relating to the tenants. What we've done since then, we worked with a local and a national consultant. We worked with tenants in the community and with a variety of different stakeholders. And we have done a lot of things to change. We've added a gate to the garage for security. We've added security cameras. We have 24/7 staffing now, and they are people who are trained to work with our tenants. And then we also put a front desk so that tenants have guests. The guests have to check in because we were finding a lot of what was happening was individuals that were guests or people from the community that were coming in were bringing in some of the issues as well. But two things I do want to point out. One is that we've had people who we do work on them with a relationship and we do get them to agree to go into treatment. And our mental health facilities and our chemical dependency facilities do an amazing job here, but there's not enough resources. We've had one individual, just as an example, worked with her for months, finally agreed to get into treatment, really needed inpatient treatment. And the soonest that anyone could get her in was 2 weeks. And a lot can happen in 2 weeks, unfortunately. The other thing I would say that I think people don't always realize is that the way the laws are now, we have to follow tenant landlord laws. And that sometimes can constrain us a little bit, just because, you know, if you had somebody in normal apartment housing that was utilizing illegal substances, it's the same type of thing. We can't simply ask them to leave. We have had situations though, where we worked intensively as we do, because we don't want anybody to have to leave. We've had situations where people were doing illegal activity in their apartment, and we have had to ask them to leave, but we have to follow that tenant landlord law that's established for anyone. So I think that's important to note. We also do rental assistance for Federal Way, Kent, Renton, SeaTac, and some other areas. And just a little bit about COVID, we've seen an increase in customers. We've seen an increase in new customers, and we've given out quite a bit of rent assistance. And in our properties that we own, we found that an average of 28% of tenants at our properties were late or weren't able to pay rent at all, but it fluctuated as high as 60% with some properties. And it's everything from job loss, loss of hours, medical issues, and lack of childcare. But one of the concerns I just want to share with you as well is that we have seen in the past with the recession a delayed impact, meaning that people will come to us and they've gone through their entire savings before they come to us, and they've never needed services before. And so even as the economy starts to pick up, these customers have a success, I should say. They are eventually successful. But especially with rents going up and cost of living going up, that is something that we are very concerned about as well. Was I within the time limit there?
Just about. Thank you.
right.
That's it. All right. Very good. Thank you very much.
Sure.
And thanks for your work there. Okay. Robin, how many years you've been at Multi-Service Center now? That's great. Thank you. Okay. And David Harrison, Fusion. So we got, if David does 5 and Bill does 5, we're right on track.
I'll try and keep it less than 5 then.
All right.
Let Bill have the rest of it. Thank you. My name is David Harrison. I'm the Executive Director of Fusion, located here in Federal Way. Real quickly, for those of you who are not familiar with our organization, we have 20 transitional homes in Federal Way and Northeast Tacoma. We also operate a 31-room emergency shelter in Federal Way. We also have the Fusion Decor Boutique that we sell new and gently used furnishing, the plug for the boutique and Peggy. Where you can the money supports our programs. We also have Poverty Bay Cafe, which was gifted to us a couple of years ago, which the plan is to use that as a job skills training program, very similar to Fair Start that you talked about. And that's how kind of a wraparound service for helping families that are experiencing homelessness in our community. Quickly about our values, what separates us kind of from other service providers. We believe in supporting families to identify and develop their skills that leads towards self-sufficiency, and that we believe very strongly that homelessness should be rare, it should be brief in its duration, and it should be non-reoccurring. We screen our clients to make sure they're a good fit for our program, and we expect them to accept reasonable assistance in search for housing and other issues impacting their family. And if that's not the right program that they want, then we'll help them find a program that is a good fit for them. And we do ask people to leave if this is not a good program for them. Outcomes for us may be typical housing, like rental market rate housing. It may be transitional housing programs through us or other service providers. Sometimes it's with family, sometimes it's with friends, sometimes it's out of state. But our goal is to not return that family to homelessness. To date, we've helped more than 122 families in Federal Way. And what we see as a service provider is a lot different than what I think people perceive the issue of homelessness to be. I think if you were to ask the general public, someone's homeless, what do you see? It's an individual pushing a shopping cart down the street who probably has mental health and addiction issues. And that is just one of the many faces of homelessness that we see as a service provider. Not all addicts are homeless, and not all homeless people are addicts, as an example. We see single adults, we see teens, we see single parents, we see couples, and we're seeing a lot more, as Robin mentioned, multi-generational homelessness, where we see grandma and the daughter and the kids. And one of the key things that we're trying to break as a service provider is break that generational cycle. My grandmother's homeless, my mom was homeless, I'm homeless, my kids will be homeless, and we extend that problem. If I could have a wish list of anything, I would invest in mental health. I think the one thing that we're missing as a service provider is being able to provide mental health to the people that serve us. We have parents that have mental health issues. We have children that have behavioral issues. We have seen families who have not considered going to a shelter before because they don't want to expose their kids to what the typical shelter will be, which is perhaps somebody has mental health and addiction issues. And so we're seeing a lot of families who have never come to us before or been in a shelter because they didn't want to expose their families to a shelter. And one key thing for us is capacity. More housing is one of the answers, but it's not just the answer. We have a metric that we use in our program, which is called length of stay. A year ago, the length of stay for a family staying with us was more than 100 days. We have invested heavily in case management and working with the families that have now reduced that length of stay to less than 60 days. So a family comes to us, they are enrolled in our program, they are held accountable, they are given appointments to work with their case manager, they have a family stability plan that they are to execute, and we work with them through that program and get them on to the next step in their housing journey in less than 60 days. By reducing that length of stay from 100 days to 60 days, we've added capacity. Without investing in any additional buildings and capital expenses, we've been able to serve more families just by reducing the length of stay. And in summary, we are seeing overwhelming requests for service. The phone rings constantly of people seeking housing right now. Lots of young families, a lot of families with newborn babies that are living in their car. There's not enough room for everyone. We have upped our program to provide more case management. And as I mentioned, if I could have one wish, it would be more mental health funding for the families that we serve. And I do want to just briefly address one of the comments that came up. For us personally, we do have security on site. We are staffed 24/7. We have cameras throughout the building. We have a code of conduct that no alcohol, no drugs, no visitors, no unattended children, no screwing around, or we will ask you to leave the program. And that's it. Thank you very much. Any questions?
Thank you, David. Appreciate
Can I
it.
ask? Can I ask one?
Sure.
How many units? I'm sorry, I missed that.
We have 20 transitional houses and a 31 room shelter.
31 one-room shelter.
I'm sorry,
31.
31 rooms in one shelter. Yes. 31 rooms.
Thank
Great.
you.
Okay, thank you very much. Bill Hellerman, Catholic Community Services. This will be a real hat trick if we can get all this in by the time. All right. Thank you, Bill, for coming.
Okay, great. Let's see. I'm not as adept as Robin is at go here. Is that the easiest way to do it?
Can it be made full screen?
Make it full screen. Click. Great. I'm Bill Hallerman with Catholic Community Services. I'm going to move real quick too. This is a little bit of a graph that shows the programs that CCS and CHF, Catholic Housing Services, have in South King County. I'm just going to focus a little bit on the Federal Way programs that are in Federal Way Family Center. We have expanded in the last 3 to 5 years in a lot of our work in South King County because the need's been so great. If you go to the, I just want to focus on three programs. The Crew Behavioral Health Outreach Program. So that's under the Federal Way Family Center. And that is a team of 5 folks that are, CCS is a licensed behavioral health provider. So mental health and substance use. So we have a team of 5 folks who work in South County doing outreach to folks in encampments and day centers and shelters to try to connect them up to services. We work in conjunction with the Federal Way Police Department. Like, for instance, last Wednesday, we went out with them to visit an encampment to try to engage folks into services, to bring them in to get services, mental health services and behavioral health services. I'm also going to I'll talk a little bit about the day center and then about the shelter. So our day center, which is just around the corner, we see about 1,000 clients annually, 9,000 visits over a year. 50 to 60 people is our average on the day. You can see on the side there that the total visits that we had. There's a little gap because we did some construction there to get it fixed. During the past year, 128 people we connected to housing. That's to permanent housing out of the day center. And that's in addition to the single adults that come there, we do work with families, especially families that have got behavioral health issues. So if they've got mental health issues and substance use issues and health issues that are very serious, we have a contract with the Regional Homelessness Authority to work with those families in a special way because it's difficult. It's especially kind of challenging for them. We also have a new partnership starting with this fall with UW Medicine and Public Health to bring healthcare services to the day center 2 days a week, which will bring nurses and doctors and to deal with some of the medical stuff that we're seeing there. This is just a picture of the day center. We did that renovation and remodel, and now we actually have a little bit of a community garden that folks work on, and we use the stuff, use whatever we grow to have folks cook with and to learn to kind of get healthy habits as they move into permanent housing. I want to talk then about the shelter in South King County and what's happening. So when COVID hit, CCS, we ran 3 shelters that were night-only shelters in South County, in Renton, in Kent, and in Federal Way. And you folks are very familiar with Reach Out, which was the shelter that we worked with, which housed folks in churches in the evenings and then didn't have any place for them during the day. So when COVID hit and we had so many outbreaks in congregate shelter, what we did was pull those 3 shelters together with the help of King County and move them into a hotel in SeaTac. And what that enabled us to do was to turn what was night-only shelter into 24/7 shelter. So what that gave us is some of the things that you see on the slide in front of you. Better permanent housing outcomes when we move to that 24/7 facility-based shelter. And that's because clients would have better access to services without that traveling between day centers and libraries and shelters, much like you'd think. Also, housing plans became much more easy to facilitate. Anybody that comes into to our shelter immediately sits down with a housing case manager and gets a housing plan for permanent housing. That was very difficult to do as people were having to move all around. We had a much greater ability to provide behavioral health services at the facility, to bring them at the facility where folks were 24/7. So I think that bodes well for the health through housing and what we've seen early on in our health through housing project in Renton. Having behavioral health at the facility all the time is very, very helpful. The 24/7 shelters led us to much better health outcomes for the folks that we serve. And that was obvious during the pandemic. Individual motel rooms was obviously much safer for the community and for the people we serve than putting folks in a big room where we're all breathing the same air. And then clients, we also found were able to have better access to nursing care and healthcare there. And then finally, I'd say that as many of us morphed our services to some virtual issues, I think we found that there's still an incredibly important thing for the face-to-face centered work that we do with individuals, much like multi-service does and much like other folks at Fusion do. That we've morphed a lot of services to virtual, but in folks that are really hard to serve, and I think that the one-to-one individual face-to-face work that we do with folks is probably the most important work, because it's what builds a relationship with them that helps move them towards change. So that's out. We have been at we were at CTAC, and so the South King County Shelter, which you all are aware of, we're hoping. We say is coming this winter. I don't know. They're still doing remodeling on it. The former Red Lion that's on 348th. You'll see many of these services will mirror some of the services that Leo talked about. So 85 units serving single adults and couples without children, 24/7 facility-based low barrier enhanced shelter, housing case management for all clients, on-site behavioral health services, clients with a full meal plan. The clients will get entry to this through former shelter programs, day centers, and outreach workers in South King County. This was purchased by King County and will be operated by CCS. And it's a replacement plan for sheltering single adults and couples without children, which was previously Reach Out, Arise, and Home. And the final slide, I wanted to give folks a little sense of the data. So this was a South King County shelter. When we pushed those shelters together from July 1st of last year to June 30th, we've moved 124 individuals into permanent housing. And almost every one of them were South King County folks, because we filled the shelter with South King County folks from Renton, from Kent, and from Federal Way. And the most important thing that we do, one of the most important things we do in shelter is have that housing conversation with people right away when they come into shelter, and with a focus on permanent housing. That's an incredibly important thing. And so we are looking forward to working closely with the Urban League and to move many of our folks that are using the day center and the shelter into permanent housing there, and in all the other permanent housing that we try to move folks into.
Thank you, Bill. And thank you for the work that CCS has been doing all these years, and all of the providers. And Bill, the expanded space there on 13th looks beautiful. Thank you for the tour. The day center looks amazing. And then thank you so much for the work that really has blossomed at that location. And thank you for all the service. I'd like to thank Leo. Thank you once again for coming down, your partnership. Alexis and Abby, thank you so much. And Abby, it was nice to meet you. Alexis, great presentation. Can't believe you got that done as quickly as you did. Robin Correct, thank you for 21 years of community and service. David, great job and welcome to your new leadership role. And Bill, as always, as I said, thank you so much. We have our city council meeting that starts in 16 minutes. And I think that we've got a pretty quick executive session that we'll need to recess for. This will be collective bargaining pursuant to RCW. Oh, I got to take out the glasses. 4230-1404B. We will be roughly 16 minutes. All right. Thank you.